Thank you.
Okay, Bismillahirrahmanirrahim. Can I have everyone's attention? We're about to start. First of all, I would like to welcome everyone in this Zoom meeting. Kindly, if everyone, I can see that all the mics are muted, but just make sure that your mics are muted through this session. Ryan, yeah, please. Thank you. Please mute your microphones. We're just about to start. Just a few announcements before we start that we have two talks primarily, after which we will open for a question answer session. Please keep your questions till the end of the two talks. In the meanwhile, you can also post questions while this speaker is speaking, just so that we can record your questions and address them at the end. So, Bismillahirrahmanirrahim, my worthy seniors, colleagues, and young residents, Assalamu alaikum. Welcome to the IRC RCOG Pakistan's first Zoom-based academic session. The chair, IRC RCOG Pakistan, Professor Colonel Nazli Hamid, plans to hold this activity periodically. She believes that everyone has the potential to make a useful contribution and looks forward to your valuable constructive feedback. There are two talks today, as I mentioned earlier as well. In the first talk, Professor Nazli Hamid will tell us briefly about the current academic statistics from the college. In the second talk, Dr. Rabia Mushtaq will tell us about the career pathways for Pakistani doctors in the UK. As all things must be started with the name of Allah, we will start by the recitation from the Holy Quran, and after that, we'll resume our talks from our speakers.
In the name of Allah, the entirely merciful, the especially merciful. Say, He is Allah, who is one. Allah, the eternal refuge. He neither begets nor is born. Nor is there to him any equivalent.
So, moving on to our talks for today. Again, let me remind you that we'll be having a question answer session at the end of the both speakers' talk. So if again, in the meanwhile, if you have any questions, you can always post them and we can address them at the end of the two speakers. So our first speaker, as I said earlier, is Professor Colonel Nazli. She's an FCPS and FRCOG. She served in the armed forces for 28 years. Currently, she is working as a professor in OBS and Gynae and medical education adjunct faculty member in Shalimar Hospital, Lahore. She has been an IRC member and then a fellow in the last two consecutive terms. She has recently been elected as the chairperson of IRC in July 2022. Without further ado, I call Dr. Nazli to address everyone.
Assalamu alaikum. Welcome to this meeting today. I'm grateful to the administration of Shalimar Hospital for providing me IT support and all the logistics needed for this facility. So I shall primarily be updating you about the IRC Pakistan RCOG collaboration, the recent update. Slide share, slide share, screen share, screen share.
Screen share.
Right. So are you able to see the screen? Okay, fine. So basically we will be talking about the IRC RCOG Pakistan collaboration. And I'll be updating you on what we have latest here. Next. Okay, so the main idea of creating this Facebook page and holding these meetings is that the college has a strict privacy policy, data protection policy. And although there is a lot to be shared with the fellows, members, and the budding doctors, we do not have precisely their phone numbers and their contacts because of the data security policy of the college, and they want the chair somehow to convey that information, which is so vital to be shared to all the colleagues. So I got an approval for having a social media page, this Facebook page, and also intend to record these meetings so that we can approach wider audience, we can approach different supervisors, different consultants, junior and senior consultants, so that they can in turn approach their residents, and the word of mouth spreads. So we plan to hold monthly Zoom-based meetings on different topics of interest, which we will identify from the different chats, the WhatsApp groups, the Facebook pages where you post questions, Messenger where you keep on posting messages to me. So I keep on picking ideas from there. And the main idea is to guide our doctors about the RCOG-led training programs to help them progress and excel in their careers. And also, whenever needed and whenever requested, we will be holding academic sessions and recording those academic sessions for the help of those people who are not able to join in that very moment, because we are all busy people and busy clinicians, and logging on to one particular channel at one particular time may not be feasible for everyone. The main emphasis of the college is currently on promoting MTI placement. MTI is Medical Training Initiative, and we need to create awareness and conduct interviews of the candidates to shortlist them. And then they are competing actually in the global market. So we can at best nominate MTI candidates from Pakistan. We can create awareness, we can shortlist them and send them a list of 2, 3, or 4, whatever number of prospective candidates we have selected. But then once they are selected by IRC, they are not it doesn't mean that they have been finally selected by NHS. They are actually competing with other contestants from the global market, and then from them they choose the best possible candidates. So when I reviewed the data, I saw that in the last year, only one MTI candidate was there from Pakistan. So that was disheartening. But what was more surprising for me, that from entire India, only 2 MTI candidates were there. So we discussed, why from such a big region, and where we think that people are actually probably more progressive and they are probably availing opportunities more often than us. So why their number is less. So many flaws were identified, and which I will be pointing to shortly. I intend to conduct the prerequisite workshops for progression in MTI in Pakistan. These workshops are not mandatory to qualify for a training slot in MTI, but in MTI, you basically go at an SHO level, ST2 level, and within 3 to 6 months, you have to progress from ST2 to ST3 level. And for that, you need to have done these workshops. So at that very moment, these workshops become a prerequisite. And if you haven't done them, your progression to the next stage is halted, and which is detrimental to both our interest and the interest of the college as well. So I am collaborating with them to hold these workshops, the prompt, CTG interpretation, and perennial repair workshops here in Pakistan, so that when our candidates are competing with global candidates, they have got a better merit list by having completed these workshops beforehand. We also plan to have MRCOG 3 preparatory courses. I am yet brainstorming how to do it more effectively, whether to launch a specific program and select a batch of dedicated candidates who will, follow that course through. And we plan to have a little subsidized honorarium for that course, because the college doesn't fund us for any IRC related academic activities. So whatever help I'm getting from my own institution, I'm grateful to them. But for whatever logistics we have to arrange, we have to raise some funds as well from our own resources. We have to encourage our younger fellows and members to actively participate in the RCOG events. The upcoming RCOG conference, World Congress, is to be held in the first week of May 2023 in UK. And I want to take this opportunity to publicize that as well, that you better start working on your posters and your presentations in time, so that you submit the proposals in time and they are approved. We plan to conduct a symposium under IRC RCOG cover as a hybrid event, thanks to this innovation in technology. That will also help us save some cost, because we can't sponsor all the speakers traveling abroad without funding. So the current RCOG membership statistics from Pakistan, isko window ko nikal de, ye beech mein hai, So the current statistics जो है ये, so 48% of the total RCOG members are from outside UK. In other words, अगर कॉलेज में 7,000 मेंबर्स हैं तो उसमें से 3500 जो हैं वो यूके के अपने हैं और इतने ही जो है वो यूके से बाहर के हैं. So 22% of the total RCOG members and fellows are from Asia. Out of that 22%, the total Asia membership actually turns out to be 3,384 as far as 2021 statistics are concerned. And you can see that only 297 candidates are from Pakistan. So we have only 297 registered members and fellows, 100 fellows who are actively serving at the moment, 22 retired fellows, 100 members in total, and 75 associate members. So that makes a total of only 297 till January 22. We need to build on that. We need to improve that. So our pass percentages in the different examination, these are the statistics from 22 examination. In January 22, our pass percentage in MRCOG Part 1 was 70% compared to the global percentage of 53%. So we are significantly better than the global percentage in this area. In January 22, MRCOG Part 2 pass percentage was 18%, 10% lower than the global pass percentage of 28%. And in MRCOG 3 May 22 exam, 46% passed compared to the global pass percentage of 62%. So from this, I gain that we need to work primarily on MRCOG 2 and 3 areas to help our candidates boost their skills. In the MRCOG Part 1 examination, the next examination is due on 19th and 20th of September. The booking is already open and will remain open till 29th of August. Pakistan has 773 candidates currently eligible to sit in MRCOG Part 1. That includes 229 new candidates who are now declared eligible and 504 deferred candidates from the previous exams. At the moment, 300 seats are available from Pakistan to sit in MRCOG Part 1 examination, but only 59 candidates had booked till 29th of July. So we are utilizing as little as 1/6 of the available seats. So, and whereas we have so many eligible candidates. So we can create awareness, we can motivate our students and residents that they should appear in time. And I shall emphasize shortly why it is more important to emphasize it right now. In MRCOG Part 2, the dates are the same. Pakistan has 590 candidates eligible to sit in MRCOG Part 2. That includes 81 new candidates and 509 deferred candidates. 260 seats are available from Pakistan for the MRCOG Part 2 examination, and only 95 candidates booked till 29th of July 22. So again, we are not using as much as almost 165, 170 seats. Now, this is particularly relevant because this is the last particular exam in which the deferred candidates so far can appear without having to pay again. So you can't linger on forever. You have to utilize this particular opportunity in case you do not want to bear the penalty of paying again. So please avail this opportunity. All those who are already eligible, that means that they have already created their portfolios, they already created their profiles with the RCOG. So please pursue that and avail it, because otherwise you'll have to pay again for the next exam if you don't sit in this exam. A couple of you also posted this question on the web page, on the Facebook page, that what are the deferred candidates? So deferred candidates are those candidates who booked a place for an earlier exam, but they were not able to sit in the exam due to COVID or due to any other reason, or if the exam was deferred till a later date. So for all them, this is the last window of opportunity. Please avail this. All exams are to be run at Pearson test centers, but there are 5 centers in Pakistan: Faisalabad, Islamabad, Karachi, Lahore, Multan, and Rawalpindi, and you can choose whatever center suits you the best according to your current residential address. Next. So as far as MRCOG Part 3 is concerned, the next exam is due on 7th of November, and it will last till 15th of November. At the moment, it is being supported by UK, India, Egypt, UAE, and Singapore. Now, I know that this is a burning desire in the heart of everyone that MRCOG Part 3 examination should be in Pakistan, and this point has also been taken up with RCOG in the latest meeting. But we have got two significant limitations. Although RCOG is giving us a promising support in this area, but we have to work on two major problems, in this region. Number one, we have to increase our number of candidates to make it economically more feasible for them to hold an exam here. If we have just 3, 4, or 5 candidates, so it's not logistically appropriate to conduct an exam here. Number two, travel restrictions from the nearby region. So if those travel restrictions are eased out, then only we can hold the MRCOG Part 3 examination. Till that time, we can avail the opportunity of nearby countries for our candidates, for them to go there and take an exam. Regarding the mode of examination, it will be a traditional face-to-face examination in the UK. This has been finalized. But as far as delivery in other centers, India, Egypt, UAE, and Singapore, it has yet not been finalized. This delivery for overseas centers is yet to be confirmed. It may be a face-to-face examination, or it may well turn out to be an online examination. Assessment for training closed on 8th of August. Now this also I posted on Facebook page, and then I kept on getting different questions. And a candidate asked me that my assessment of training was done in 2016. Can I appear in the exam now? And I will answer that question in the next slide. So booking will open for this particular exam in the end of August. So it's about to be opened. Exact date is not yet announced. Regarding assessment of training, candidates need to complete assessment of training only once, whether it was 2016, 14, 13, whatever. Once you have taken an assessment of training, completed that, you've submitted in the college will give it update in your record that your assessment of training has been done and will send you a confirmation. You've got that confirmation. After that, you are allowed to proceed to MRCOG Part 3 examination. For every subsequent attempt, you do not have to take an assessment of training again and again. Regarding MTI, we are going to have a separate talk on 26th of August by a very learned speaker who will be talking about the latest regulations of MTI, as well as the shortcoming in the interview skills of our candidates. But I will just emphasize a few points here, which were highlighted by the college, that the main emphasis of the college when they are taking MTI candidates from our part of the world is not on how many gynecological surgeries, how many abdominal hysterectomies or 100 vaginal hysterectomies they have performed. They mainly want to know that you have good communication skills, you can break bad news effectively, clinical governance, you have an idea of patient safety, risk management, and the clinical expectations that they have from you are level 1 to 3 cesarean section, safe vaginal and instrumental delivery. So the trainee, what should the trainee expect? So this is the second difficulty that they highlighted, that the trainees, once they go from Pakistan or from any part of the world to UK for an MTI, they think that probably they are straight away going to do laparoscopic hysterectomies and advanced level 4 laparoscopic surgeries. So you are mainly expected there to have good obstetric skills, and that will be your desired, clinical competency there. And at best, you will be performing level 1 and level 2 minimal access surgeries. They have encouraged some excellent MTI candidates and involved them in making local guidelines, different research programs, in postgraduate training and local teaching programs, in making rotas, audits, and few candidates have been very successful, and one from Sri Lanka is also running a local MTI champion program in Sri Lanka. So there is a lot to build upon, even from those skills which are being taught there, rather than having false expectations and then getting disappointed yourself as well. The main problems that have been identified why the candidates do not get selected is that many of them have submitted incomplete forms. They have not completed the workshops that I just mentioned, the prompt, the CTG interpretation, the perineal repair workshop. They haven't done it before, and during that particular 3 to 6 months of orientation period where they have to progress from ST2 to ST3, they are unable to complete it. So that creates a hurdle. They cannot progress further. Then poor interview skills of the candidates. So that's why the next talk on 26th of August is also going to focus on how can we improve our interview skills. Inconsistencies in clinical training, because the way we write clinical trainings and the way they assess competencies is different. So there has to be a common ground on which we assess our candidates from here in a way which is acceptable to the Royal College. The biggest problem is that MTI candidates quit once they are doing MTI training there and find another job in UK and switch jobs, which is very, very objectionable, because although it is very easy because they get ST5 visa for going to for an MTI program, and for local residency they don't only need ST2 or ST3 visa, which is very easily convertible once they reach UK. So as far as they themselves are concerned, they probably switch to a more lucrative program. But as far as their national obligation is concerned, they create a hurdle for the followers. So once they do it, the entire region earns a bad name, and they don't encourage people from that area. So and secondly, because the cost is borne by the hospital, the MTI placements are done by NHS, not by individual hospitals, but the cost is paid by the individual hospital. So once a candidate switches the job and goes to another program, the hospital faces the financial loss as well. 68% of the students who have gone to MTI haven't yet returned to the country. So that creates a hurdle, that creates a very negative feedback. And we have to work on this. When we are standing on international platforms, we stand not as individuals, we stand as Pakistan. Our each action is reflected on our country in general, and we have to be very aware of that. The proposals made so far to avoid these problems by the college is denying those candidates permanently a right to appear in MRCOG Part 3, which is going to be a big penalty. So we have to be mindful of that. And now the training agreements are also being redesigned, and the latest ones have been updated. And the next lecture on 26th of August is going to be based on the latest of MTI. That's why I did not include it in this session, because I wanted them to be updated before we finally talk on them. There were payment concerns of many candidates, especially during the period of election. Quite a few people approached us that they have been having difficulty in making payments. So TransferMate and Western Union are now functional, and you can make your annual fee subscriptions by these two methods. Finally, I will conclude by saying that although we can talk endlessly about what should be done and what is not being done, there is so much that can be done. So we should not focus on non-doable things. Rather, if we just focus on doable things and contribute in our little capacity, whatever little we can make a difference, because better is possible. It doesn't take a genius. It takes diligence. It takes moral clarity. And above all, it takes a willingness to try. Thank you so much.
Thank you, Dr. Nazli, for this wonderful talk, and I hope everyone does benefit from it. So there are a few people who have posted questions. Let me remind you, keep posting those questions, please, and we'll address them at the end of the two talks. But someone was saying that their voice, you can't hear the audio properly. I don't think anyone else is having that problem. So Dr. Faiza, if your problem is solved, kindly let us know. And also encourage other people to keep on requesting to be admitted in the room. And I'll tell the speakers to keep admitting people as they sort of give the request. So now our next speaker is Dr. Rabia Mushtaq. She's an FCPS and MRCOG. We're very thankful that she took our time to be with us here today. So thank you, madam. So Dr. Rabia has over 18 years of experience as an obstetrician and gynecologist. She has 10 years experience in the UK and most recently was working in the NHS as a consultant. She's an author of a book for MRCOG and has published her work in several international medical journals. She will talk about career pathways for Pakistani doctors in the UK. And now I give the floor to Dr. Rabia Mushtaq. Please keep an eye on the screen and just keep admitting people.
Assalamu alaikum, everybody, and good morning. I'm very thankful to Dr. Nazli for this opportunity, and I think it's a wonderful way to start this new journey. So I have worked in UK for a period of 10 years, and recently was working as a consultant before I came back to Pakistan. And I feel that it is really important for the doctors here to have an understanding what are the career pathways, what are the opportunities there for them to avail if they decide to go abroad. While I was preparing this presentation, I think I paused and I asked myself that the very first question that a person should ask themselves is that why do I want to do that, and what is the purpose? It's very important that you pause and ask yourself, where do you see yourself in 10 years' time? What is the aim of this exercise? And where do you see your family in 25 years' time? And then plan accordingly. It's important to set your goals and work at a comfortable pace for yourself. For myself, I felt that working in UK was a great opportunity. I got to learn a lot, and I would encourage other doctors to do that as well. But again, have a look at your life, and everybody has a different journey. Decide it for yourself and then follow it if it is right for you. So there are a few things that I would recommend, and that is be your own friend first. It is really important to do the research yourself. When you're asking for help for about any pathway, if you have the background knowledge, the attitude of the person unconsciously, subconsciously changes and becomes more helpful once they realize that you have done some background search yourself. There is a lot of information available on the websites. GMC website is very helpful. Similarly, Royal College of Obstetrician and Gynecologist, you can find a lot of information in the frequently asked questions. And also one more thing, people in GMC are really good at replying to the emails. So I would strongly suggest that if you ever have a question and you are struggling with it, please ask, don't shy away from it. It is always good to ask, and it is very likely that you would get the answer, provided you have done some background research. Bear in mind, we are skilled doctors. We have a lot of workload when we are working in Pakistan, and surgical skills are usually not a problem. The aim is learning to communicate better and to follow the guidance to the T to become safe doctors. That has to be the aim. And as Dr. Nazli had previously mentioned, when recruiting for MTI, their concern is not your surgical skill. Their concern is your communication skill. And their concern is, are you a safe doctor? Bear that in mind. Am I a safe doctor? The statement that I am making, does that make me sound like a safe doctor? The routes for GMC registration. So the usual route has been through IELTS and PLAB, and has been used by many doctors. Then there are certain qualifications. If you're qualified from EU, then certain qualifications are acceptable, and then you can have the GMC registration directly. Bear in mind, if you are MRCOG, congratulations to you, and then that makes you have GMC registration as well. Unfortunately, there was a time when some of the FCPS qualifications were considered good enough for admittance to General Medical Council register. UK, however, this status has been revoked. And the next pathway is through getting a training number and having a completion CCT, that is the completion of the training certificate. And then you are admitted to the specialist register. Dr. Nazli has spoken about MTI today, and the plan is to speak about it again in detail later as well. I would just briefly touch it today. And the last pathway to have specialist registration in General Medical Council is by a route of CESR or CSER, which I had to go through, and I would be Really honored if any of you need any help about it, and if I'm able to guide you, please do not hesitate to ask. So the first route, as I was talking to you about, is IELTS and PLAB. In India, Pakistan, and Sri Lanka, because English is spoken as a second language, most of us are able to clear IELTS. There are certain courses that you can do to clear that as well, and then followed by PLAB 1 and PLAB 2 examination. Although I had already done FCPS, but I had to go through this route because before clearing FCPS, I had attempted PLAB 1. So once you start a route, it's better to stick with one route so that you do not have to duplicate things. If you have started the PLAB pathway, then you will not be admitted based on any other pathway. Therefore, you have to make sure that you choose wisely which pathway are you going to choose. Once you have cleared PLAB 1 and PLAB 2, you would have a provisional registration. And if you're working in UK for a period of a year, you would be granted full registration with license to practice. And after that comes the specialist registration, which is by CCT or CSER pathway. So there is a newer version, which is the occupational English test, which seems to be replacing IELTS now. The reason for that is because it is seen to be useful in other countries such as USA, Australia, Ireland, as well as UK. Therefore, many people who are a bit undecisive whether they want to proceed with immigration to UK tend to do occupational English test. You have to make sure that if you are going to work as a doctor, you have to apply for the medicine version of the test. You need at least grade B in all the components. One thing that I found very useful while preparing for PLAB was that make BBC your background sound. The more you hear English in the accent that is there, it would help you with the listening. It would help you with the speaking itself as well. So that's probably one tip for the English test that I'd give you. Next route is MRCOG. If you are preparing for it, then good luck. And if you have cleared it already, then congratulations. It is a route for GMC registration. Bear that in mind that all trainees in UK are required to pass MRCOG at the level of ST5, which is the 5th year of training out of the 7 years, so that they can progress to the senior registrar rota and complete their training as ST6 and ST7. Similarly, for you as well, if you are planning to have a longer stay in UK, it is important to pass MRCOG. By the time, I would recommend doing that by ST4 because it would open up career opportunities for you more. If you have done MRCOG while being in Pakistan, then hats off to you. First of all, that you have not worked in the system, but you have managed to do so. And the other thing is that if you are planning to go abroad, it is important not to jump in to the registrar rotas first. I would strongly advise, for your safety as well, to start as a house officer and then progress from there, because the system is different. We are not questioning your skills, but the question is about the communication, understanding the system. And then once you're comfortable, go ahead and you can always join a registrar rota. Apologies. Next is, so CCT and CSER. When I went to UK, it was very difficult for a non-trainee doctor to enter into the training system, and there were no seats available, and I had the only choice of CSER. Currently, there are training posts that have started to come up at the level of ST3 as well as ST5, which opens up more opportunities for you guys to apply at training at different levels. It is important to make sure that you look at the RCOG e-portfolio and you are ready for the level that you wish to apply for, because your e-portfolio would be looked at and assessed before they would offer that post to you. I think for ourselves, it's important to make sure that we keep a trail of the paperwork, work smart, and have all the things that you have done, you are assessed for it. Once you get a training number, you get rotations in the region. So you do not complete your training in one hospital as it tends to happen in Pakistan, but you go into you rotate in all the hospitals in the deanery, which gives you exposure of different consultants, as a result of which it enhances your learning. And the second route is CSER, which I did to get my specialist registration. It is a hard road, but it is doable. So the application itself is 1,500 pages, and you need 5 consultants to give you a reference, including 1 anesthetist. So it is important that if you're working towards CSER, you're making friends on the way. And making friends actually means working hard, working smart, making sure that your professional capabilities are recognized, because you would need references. If there is another pathway of doing CSER from abroad, however, it is probably much harder because the assessments need to be seen. I have seen people from other specialties who have gotten CSER after working abroad, but to my knowledge, I have not seen yet somebody who has done it in obstetrics and gynecology after working abroad. One of the reason or difficulty is for CSER application, you need to have done 2 advanced training modules or ATSMs before you can apply for CSER. So let's talk, while we are at the subject, let's talk about the advanced training modules. So once you have cleared MRCOG part 2 and you are at a level of ST5, the expectation is that you would choose 2 areas of expertise, which would be your main areas while you would be working as consultant. These areas can include lucrative things like advanced benign laparoscopy, colposcopies, hysteroscopies. However, bear in mind when you are choosing for it, look at your interest. However, it is also very important to look at your future plans and job forecast. It has been recommended by RCOG to consider advanced labor ward practice module, because there is a market for the consultants to work at labor ward. Therefore, this advanced training module is, although not mandatory, but highly recommended to be carried out as one of the 2. You can start the 2 advanced training modules together. The work intensity cannot be more than 3. There is information on the work intensity available on the Royal College website. It's important, like when I was trying to get my ATSM after I had completed MRCOG, bear in mind, trainees would have an edge over you while getting ATSMs. So if a trainee is doing an ATSM and hospital has only 1 slot for the advanced training module, a trainee doctor is likely to get it as compared to a non-trainee doctor. So it is important when you're going for your job interviews, looking at the hospitals, they ask you, what is it that you are trying to get out of this job? State it clearly. You want exposure to this field. For example, I did my advanced training module in reproductive medicine. I made sure that it was an understanding from my job interview that my aim is, or my change of the hospital is because I am looking to have my advanced training modules to be done. So it's important to state it in the beginning rather than expecting that it would come to you later. There's a difference in the culture. In Pakistan, what we see is that I have worked hard and therefore it should be recognized and given to me. However, in England, when you are working there, it is seen as you don't ask, you don't get. If you are not asking for something, it means you do not feel that you deserve it. And that's why you wouldn't get it. So it's important to bear that in mind, that it's very hard for us culturally to go and ask, can I please do this? Can I have this advanced training module? This is what I expect out of my career. But it's very important to state it clearly. Do not expect others to offer it to you unless you have worked towards it and you are able to show the evidence why you would be a good candidate for something. So again, I think I'm just going to touch MTI as Dr. Nazli has already mentioned. It's a scheme for working for 2 years in NHS from the level of ST2 to ST5. There are certain requirements that you need to fulfill, and there is a selection criteria. I think my tip for all of you would be, when you are going for interview, uh, project yourself as safe doctors, be safe doctors. Say that you would ask for help. Do not feel, the expectation is not that a patient with the PPH is bleeding and you suddenly say, I'm going to do a cesarean hysterectomy. The expectation is that I would call for help. I would make sure that all the right specialities are there. And that includes actually the senior midwife as well. In Pakistan, we don't have the culture of saying that I would request for the senior midwife to be present, but if a patient is bleeding heavily, then presence of a senior midwife, anesthetist, presence of another consultant colleague, 2 consultant colleagues need to be there. So all this is done for safety. When you are answering a question, think of it as the patient is related to you. She is your mother, she is your sister. What facilities would I want? What help would I ask for at that time? And that's how I would attend an interview. The purpose is not to show that how good I am, how skilled I am, and I can do this and I can do that. It's more about how safe I am. I think if you do that, that alone, I think our success rate for the MTI interviews would improve. As I was saying before, our clinical knowledge is really good. Most of the doctors that I have seen from Pakistan, we seem to know due hertz from cover to cover. We know strategy from cover to cover. And when I went there, I could quote every percentage and everything. And I remember I was asked a question that what is the role of magnesium sulfate? I think this example is going to help you a lot understand that. What is the role of magnesium sulfate in eclampsia? And I started on the calcium channel pathway and all of it. How does it work to stop fits? The answer that I was expected to give was it prevents fits. So that is the level of education or understanding that is expected from you. Just say it prevents fits. That's what is needed. So our knowledge, we have a lot of theoretical knowledge. We have really good surgical skills. It's more about interpersonal skill and communication skills. One of the things that I learned there was that I went there and I was told that we can find skilled doctors, but the doctor that you can get on with, who is a good team worker, is hard to find. A job as a consultant in NHS is seen as, there's a joke going around which says that you can marry or divorce, but you can divorce your wife, but you cannot divorce a consultant colleague who is going to be in the unit. It's harder to get rid of them. So they make sure that you have good interpersonal skills and you are a pleasant person to work with. And I think these things are really important to bear in mind. Communication skills are also very important. Close the loop. When somebody has said something to you, this needs to be done at 5 o'clock with this, the patient's name is this, and you need to do it at 5 o'clock. You don't just say yes, you then repeat it to them. So this is the patient's name, this is the time. It's important to close the loop. It's important to make that communication safe. If we were doing safety huddles at the start of a surgery, what it means is that we can stop more than 50% of the errors that happens in surgery because the whole team is aware about it. In Pakistan, I find it hard to do a huddle at the minute because it is sometimes seen as maybe I don't know and I am looking for props, but it's not. It's actually, I may forget that the platelet count of this patient was low, but it would be, then the anesthetist would remind me. Theater attendant can remind me. It is important to have the hierarchy in such a way, if something is not going right, people can stop us and people can question it. And that is the safety culture. It's important that you reflect that culture in your interviews when you go for it. So don't just work towards a goal. It is important to start your e-portfolio when you are working in England, and do work on your portfolios even when you are working in Pakistan. Your goals could be broadening your professional horizon, but improving your communication skills, but make sure the goal is measurable. Just being in UK is not good enough. You should look at it as, I'm going to do this ATSM. I should be able to write with my name. this degree, or I should be able to say that specific experience, specific certifications work towards something so that it is tangible, it is measurable. Subspecialty exposures for Pakistani doctors. So I worked in Guys and St. Thomas Hospital. There is usually a subspecialty trainee in reproductive medicine. I had to make my place starting as a clinical research fellow so that I could get the exposure that I wanted. So there are ways, you'd have to find the ways, you'd have to dig deeper to have a look, how can I have exposure to that place, that particular hospital, that particular setup that I want the exposure for. And it could be through a research post as well. It does not necessarily have to be a clinical post. Once you know the people know you, then sky is the limit. There's always room for good doctors. They are appreciated, they're kept. Every job that I have worked in England, I was always told when I was about to leave that I would be given incentives to stay. And I feel that that's an honor to be at that stage. It's important, again, especially when you are in England, it could be you're thinking that citizenship is my goal, which is fair enough. But it could be that I want to get a specialist registration. I want to have a certain subspecialist exposure, or is working in UK only is my goal. Think about it, work towards it, and decide from there onwards what should be the pathway. So some more tips. As I said before, ask for help sooner rather than later. That should be a practice while you're preparing to go, but also in your clinical practice as well. In your clinical practice, document what's not documented is not done. The question that anybody would be asking when they are interviewing you, when they're looking at you, is that, does this doctor know his or her limitation? Work hard, but work smart. It should be tangible. And I think that's what I learned after working there for 2 years. Once I passed MRCOG, and somebody one day asked me about my portfolio, and I realized I haven't started one. And then I had to go through that. So therefore, I feel the guidance that I can give you is that start things early on so that the time is not wasted for no matter which pathway of working in UK you decide to go through. Thank you so much. And I'm happy to take any questions from the forum. Thank you so much.
There are any questions?
Yeah,
I think if someone wants to ask a specific question.
Shall we come together and then?
Yes.
Okay. Thank you very much, Dr. Rabia. Very nice talk and very elaborate discussion and right guidance. So I've taken a few questions from the chat box. So one question was that, is the PowerPoint presentation shareable on WhatsApp or email, or can you get a soft copy of presentation? I'm sorry, that is not possible, but we will be sharing the recording of this session on the Facebook page, IRC Facebook page, and I think that will serve the purpose for whatever you're asking. You want to refer to this information again, so yes, that information will be available, not in the form of PowerPoint presentation, but in the form of a video link on the Facebook page, IRC RCOG Facebook page. Then another question was by Dr. Nadia about the scope after MRCOG 3. I think Dr. Rabia did discuss a little about the skills training, that subspecialty training, and that has been addressed to a bit. Another candidate also asked about the video recording, so I have already answered that. Another doctor asked about the employment gap of a year, and somebody emailed me as well that she had an employment gap of 4 years. Will that be counted? So that will be counted, because otherwise this will make a very easy excuse for everybody. You know, people, if the upper limit of MTI is 8 years and people start saying that 4 years I wasn't working, everybody can say that 5 years I wasn't working. So what does evidence say? I think the better it is that you put your documents across and see how they come in, rather than assuming that this is the deficiency. But as far as my understanding is concerned, I think that will be counted. So What will be the fee of the MRCOG training courses? Part 3, we have not yet decided. So I want to strike a balance. I don't want to make it too expensive for our candidates. But at the same time, I also said that because we need funding for holding these activities, so at least we want this activity of an RCOG working to be self-sustainable. At least that much of amount will be charged that we can run these academic activities on a regular basis for the benefit of our candidates and everybody. I hope that answers your question. And if you have any other questions, please, Dr. Rabia is also here to answer them.
So 2 things that I'd probably like to answer. One was this MR after the scope of working after MRCOG 3. So I would strongly recommend to apply in a small hospital, a district hospital, as a SHO as your first job. If you work there, take a contract of 6 months, you would get to know the system. And then after there onwards, you would have experience of working in UK. And then you can apply in a larger hospital and then start working on a registrar rota as a junior registrar. And then you can work your way up from there. So that's what I feel is the safest way. The other question was that which route is better, CCT or Caesar? So many a times you do not get to have a choice. And as I said, Caesar is a harder route. In UK, it does not make a difference. People with both CCT and Caesar are given equal opportunities. However, the difference comes in if you are going to go to UAE or Saudi Arabia, that's where there are places where CCT is given more weightage as compared to Caesar. Applying for job, fixed term or permanent. Again, both the jobs, there is a period for which you can always give in your notification, whether it's a fixed job, fixed term or permanent job. You can start your first job and see how it goes. You can always give in hand in your notification if you do not feel, even if it is a permanent job. So do not feel that you are being caught there. If it is my first job, I would rate both the same, both the fixed term and permanent. However, later on in my career, permanent job would probably be something that one would look at if you, because there are many specialty registrars who are working very comfortably on permanent jobs, which leads them to have good NHS pension later on as well. Training or non-training? Yeah, so if you get training, please do get training. But as I said, they are very competitive posts. It is more likely that their already present trainees would get it as a first, they would be given priority. And other than that, as a non-trainee, you'd have to make sure that you have a good portfolio and you're working towards it. Yeah, Dr. Nas has answered it. Yeah. Different, yeah.
There's no fee.
Please explain what CCT, what does it mean? We have why we
So in Pakistan currently, there isn't any institution that would be recognized for a CCT from UK because that is a completion of training certificate of completion of training that is given to UK trainees after 7 years. And then they are on specialist register. They can work as consultants in NHS and can do private practice as well. So that is the aim of CCT. And unfortunately, we are unable to do it from Pakistan at the minute. As I said, Caesar is theoretically possible and you can be on specialist register, but I have not heard of anyone doing it from Pakistan yet. I wonder if you have heard of anyone. All right. If you have small children, it can be a bit expensive because you would need to hire childcare. I think that's an important aspect to keep in mind. So childcare itself costs about £1,600 and the pay of a doctor, initial pay could be about £2,500. So you would be actually earning for your nanny. So that's one thing that I would say. Rest of the things, there is Pakistani community around, and then you can develop a good social circle. That's about it. Yeah. So we have spoken about what should be the first.
There are quite a few questions which have been answered. You know, there are few questions which are being repeated. Like employment gap has already been addressed. What job should I apply as a first job? That has also been addressed. I've never been abroad but want to go to UK. I don't think that's a question, probably that's a comment. So good luck. So fee of MTI, somebody has questioned. So MTI is a paid job and they are going to pay you according to the, so if you're working as an SHO level, so you'll be paid accordingly. And if you progress to registrar level, which is their requirement, and actually they don't want you to remain at an SHO level, so then you'll be paid. So it's a paid job, so you're not paying for it. But the hospital which is taking you, they have to pay a certain amount of fee to NHS to get those doctors. So once you quit that job from that particular hospital and move to another hospital, that causes a financial loss to the hospital, and that creates hurdles for the next candidates to apply.
Application fee, I think that might be MTI application fee. Is there anything?
No. So thank you very much. And one question is that, is the recording going to be available? Yes, the recording is going to be available. It will be uploaded in a day. Thank you very much.
She said I couldn't hear the employment gap. And I got job for that. Should I opt it or not? If you could answer this.
Yeah, please do. If you have gotten a job as specialist in UK, there would be initial support available according to the level where you are. So there is usually another doctor which they appoint to, and you shadow that doctor for a period till you feel safe to work. Just make sure that you have someone that you can shadow for the initial period. And the things that I am saying, be safe, start as an SHO. The reason is that GMC look at these things very strictly, and if you lose your registration, that is like a loss of livelihood for a doctor. So therefore, be safe, go slow, and you get there.
Thank you, Dr. Nazli and Dr. Rabia, for very, very informative talks, and I hope everyone will benefit from this. And this is just remind you, this is just the start of many good things happening under the banner of IRC RCOG. Hopefully, the floodgates will open after this. Now, to sum up, just to sort of the take-home message, mainly again by both Dr. Nazli and Dr. Rabia, was that whatever you want to do in life, you need to make an effort. Everything is not going to happen for you, but the leap of faith is very important. And getting to the UK or any other country, for that matter, is just dependent on your mental status and how much you want something in life. So, just to sum up, now the next session will be held on 26th of August. 2022, as Dr. Nazli mentioned this earlier as well. Now, in that session, we shall be updating you about the details of the MTI program, followed by ways to improve the interview skills for the selection in the MTI scheme, which again, both our speakers have emphasized enough on the fact that the things they look upon primarily and foremost and with utmost importance is your communication skills and how you behave as a doctor, more than your clinical skills sometimes. So please keep checking the IRC RCOG Pakistan Facebook page for the updates. Again, I thank you, all of you, for joining us. This has been a very lucrative meeting. And again, as I hope, start of many better things under the IRC RCOG banner and under the leadership of Dr. Nazli Hamid. Thank you, ladies and gentlemen. You've been a good audience.